Good evening. Female fertility is the ability for a woman to conceive a biological child. Whereas age is a great determinant in women's fertility, there are other factors that can lead to female infertility, which includes general health conditions, genetic traits, and lifestyle choices, among others. But how can you improve and protect your fertility? Tonight on Health Check, we are hosting Dr. Karen Muthembwa, an obstetrician and gynecologist, ready to answer this and more concerns that you may have regarding fertility in women. You can start engaging us by sending in your question or comment regarding women fertility on our SMS line 22232 or our WhatsApp line 0708 222 and the lines are right at the bottom of your screen. You can also engage with us live on Facebook or YouTube. Our handle is at Hop TV Kenya. And remember to invite a friend or a girlfriend who will benefit from tonight's discussion. Good evening and welcome to Health Check tonight. My name is Grace Mutisa. I hope that you had a beautiful week. Allow me to invite Dr. Karen to say hello to us for the first time in the year 2023. Good evening, Dr. Karen.
Good evening, Grace. How are you?
I'm fine. And you?
Happy New Year. I'm very
Happy
well.
New Year.
It's been a long time.
Yeah.
Yes, but I'm glad to be here.
Okay, nice.
Yes.
Nice to have you. How was your day, as a gyna?
Quite busy, actually. I was early in the morning. I was in the ward doing a ward round. And later on, I had several meetings. And then now I'm here.
Yeah.
Yeah, ready to serve the people.
When you posted saying you're talking about women fertility today, many women are like, be tuned in, ready. That one, is a topic
Yes.
I really want to hear about.
Yes.
So let's begin by defining what is fertility in women.
Right. So fertility is the ability to actually conceive. And they are usually, we are only able to know that this ability or not being able to conceive after a certain period of time. So if you're having infertility, then it means you'll not be able to conceive despite regular intercourse for a full year as long as you're less than 35 years of age. But if you're more than 35 years of age, by the time you've not conceived within 6 months, then we treat you as a patient who needs some help with your fertility. Yes.
So age is important?
Age is important,
And time
is important, and also the activity of getting pregnant.
Okay. Age, time, and the activity.
Yes.
So at what point do you diagnose a lady as being not able to conceive? Let's put it that
I think
like
that's a very way,
infertile.
because the word infertile already is a big deal. Most people don't want to be told there's a problem with you, you're infertile. There's nothing really like infertile.
Yes.
You're probably just having an issue with fertility, but you're not infertile. How do we diagnose? Most of the time women or a couple will come to you saying that they have been trying to conceive for the last couple of months. Most of the time they'll come after a year, but most of the ones we say there's an actual problem is after 1 year. If you try to conceive 1-2 months, sometimes even in a totally healthy couple, they might not conceive immediately the first month or the second month. Well, of course, there are many factors associated with this, but if you're having consistent intercourse at least 3 times a week, for every week, closer to the time when you're having your ovulation and still you're not getting pregnant within 1 year, then we're saying that you have we intervene. If it's more than 6 months, like around 6 months for 35 years older women, then we say, okay, we need to do something because we don't have much time also to keep waiting until you reach a certain age to keep trying, with your fertility. So sometimes it's usually self-diagnosable. You're able to tell, by now we should have conceived, but there seems to be a problem. But remember, it's not just women who have a problem. It could also be the male partner. It's 2 people.
I wanted to come to that, Dr. Karen, because I observed at the beginning you said 2 healthy couples.
Yes.
In the society, normally a healthy couple will be the woman. Because the woman, you're able to see the ability, she has or she has not.
Yeah.
What do you mean by a healthy couple now in reference to men?
Right. You know, the thing is, you can never also really tell who has a problem until you really test them. Because we could be saying that you've stayed 1 year, and most of the time it's a woman who go to the hospital alone, most of the time, and they'll be the one. Most of the time, if there's one who has a problem, there's also a chance the other one could be having a problem. So for men as well, they might have some issues here and there, but most of them will not necessarily come to the hospital so that they are diagnosed first. So most of the time, it's a woman who will be told, maybe there's an issue here. We do all the tests. Then when we find the woman is okay, that's when we say, okay, where is the man, you know? But ideally, men, it's difficult to tell. You cannot tell unless they have children elsewhere. You know, sometimes you can ask maybe whether the man has a child before this time, when it's not necessarily you, maybe it was a previous relationship, then you can be able to tell that, okay, fine, maybe they're actually able to, because that is if those children are his. But most of the time, men are usually missed, but ideally they should be the first ones to even be tested before the woman, because their test is very simple.
Okay.
Yeah, but you can't tell also just by looking at anyone that this one will conceive, this one will not conceive.
Yes.
Yes.
Tests are important.
Yes.
You've kept mentioning the age of 35.
Yeah.
If you try 6 months, nothing, you need to see your
gynecologist. Yes.
Why is this age of 35 important? Lest we start our viewers who are 35 and
Getting
single, waiting on the yellow tent.
Right.
Say, oh my,
I mean,
Dr.
that
Karen
age
said,
graph.
I need to get quickly.
Well, it's a very interesting age because as we can see right now, most of us women who are working women, busy schedules, you know, you tend to kind of like push marriage and getting children to a bit later, and it can so happen that you get into your 30s, well into your 30s, without necessarily conceiving immediately. So why we usually talk about the age 35 and above is because by the time a lady, you know, us when we are born as babies, we are born with all our eggs inside of us. They don't keep forming like for men. Men, they'll keep forming sperms until later on in the years. But it's also good to know that also men of a certain age, above 35, their quality is not as good as if they were under 35. So we're not just talking about, we're not doing gender inequality.
It's not a women thing.
It's not a women thing.
It's both.
Yeah, it's both. But it's good to note that for a woman, the difference is the fact that these are the same eggs that you had when you were born. You're not forming new ones every single month or every single couple of weeks, you know. So you still have the same ones that are still developing, and then you produce one while you still lose some of them. Okay? So you were born with many, but by the time you reach 30, then this decline, because now we're at a certain point where they've stayed for a long time, they are declining because you've been losing one egg, the one that is ovulated, but at the same time, there are also others that they mature together with this one egg. The one egg comes out and the others die off.
Let me take you back, Dr. Karen. You know, you're saying eggs mature, we could be losing one. What do you mean by that? Maybe explain the process.
Well, yes, that's very important. Yes. You see, we have things called ovaries.
Yes.
Where the ovary is the one that holds all our eggs. And there are two of them on each side of the uterus. So they are connected with a fallopian tube, and then there's the uterus now, the womb. Yes. So the ovaries, every month, one of them will produce an egg. And this egg is released into the fallopian tube. At the fallopian tube, if there's a sperm, that's where fertilization takes place.
To form a baby.
To form a baby.
Okay.
Yeah. So now that egg that has come together, the two eggs that have come together, they form an egg, what becomes a baby now. But it has a different name. So this thing proliferates, becomes many, as they are growing down towards the uterus. And then in the womb, that's where it attaches. By the time it's reaching the womb, it has grown enough to attach in the wall of the womb.
Yes.
So now that's how you get pregnant.
Yes.
Now, these ovaries, now let's go back to where we were. The ovaries are supposed to produce at least one egg in a month. This time it could be the right side, the next time it could be the left side.
Yes.
Sometimes some people produce both The two sides, you know, it's a whole complex, you know, genetic thing that happens in our female body that's so interesting and yet so intricate that you will almost always produce one egg rather than two. But there are those people who produce two eggs at the same time, which explains some fraternal twins.
Yes.
So the eggs are always there. From the time you were born, they're just waiting. And then every month, some eggs are recruited. So they recruit and become bigger and bigger, and only one egg will make it to come out. Yes. So you can imagine every month we are losing more than several eggs because the ones that remain inside the ovary but did not come out as the one egg have grown to a level where they cannot grow beyond after the other one has come out, and then they die off.
Oh.
And that's how we lose eggs. There are many, but they keep going every month, okay? So by the time we're at 30, because you started your period maybe when you're 12, 13, others started earlier. By the time they're 30, they've lost quite a bit of eggs every month. In a way, by the time you're 30, you know, they're declining, and now they're declining very fast, you know. So that's why we keep talking about by the time you're at 35, then we don't waste time, you know, trying to wait for 1 year to conceive. If by 6 months you still haven't, let's help you. Yeah.
Okay. Now, when you say these eggs, you know, you keep losing, how is that related to the cycle, the monthly cycle? Is it related to the monthly cycle, or they just disappear somewhere inside there, the system?
Yes, it's a very interesting thing. As I said, it's a whole complex, different things working together for you to actually have an ovarian cycle. An ovarian cycle is now where you have the eggs producing hormones, and those hormones affect your uterus, and the uterus now gets ready. That's now a whole system happening at the same time one egg is about to come out. The uterus is now getting readier and readier to receive a pregnancy. But now when you ovulate and then you get a sperm in the fallopian, that's where the fertilization happens in the fallopian tube. When that happens, they produce another hormone is produced so that this uterus keeps waiting for this pregnancy to arrive, and then it attaches. So if this egg does not fertilize with a sperm, there was no sperm, or maybe it did not reach for one reason or another, then this egg starts to, it reaches the womb, but it is not grown to attach. And the hormones that it should have produced if it was fertilized is not there. So this thing starts to break down because there's no pregnancy, and that's how you get a menstruation. Yes, so it makes sense. If you ovulate, we expect you to have a menstrual period. Yes.
Amazing how God causes them to travel.
Either
to form a baby or to have your cycle. And if you're joining us tonight, this is Health Check. My name is Grace Mutisa. I'm hosting Dr. Karen Muthembwa, an obstetrician and gynecologist. We're talking about fertility in women. And I know you have so many questions regarding this topic. Our SMS line is 22232. That is 22232. You can also WhatsApp us on 0708 222 The numbers are right at the bottom of your screen. Or if you're following us live on Facebook and YouTube at Top TV Kenya, rush to the comment section. Ensure you tag a sister. You know, you tag that girlfriend who is struggling with infertility. You tag a mother-in-law who disturbs you about getting babies. You need to tag them so that they get to understand. And of course, we'll be getting to your questions in a short while. So Dr. Karen, what are some of the causes of infertility in women?
The causes of infertility are quite many. First of all, as I said, you can be completely healthy couple. The man, the sperms are okay. The lady, there's no identifiable issue, and they will probably not conceive until 1 year. Around 70–60% will be able to conceive. The next year, half of that will conceive. The third year, all of them, as long as you're healthy, you should be able to conceive. So sometimes you might not explain unexplained infertility. So you'll find in a 1 year, a totally healthy couple, they've not conceived, you tell them to keep trying the next year like that, and sometimes we assist them in different ways. So there's one, unexplainable. But the most common cause of infertility is ovulatory problems. When either there's a problem with the ovulation, this is on the woman's side. Ovulation is just, you're not ovulating, and ovulation is an intricate system of hormones working together for you to produce that egg. So you might not produce that egg because you have a hormonal imbalance, or you could be using a contraceptive, or you are using something or a particular contraceptive that can stay longer, like the depot,
Yes.
which will prevent ovulation as well. And then other things like conditions like polycystic ovarian syndrome.
Oh, that one.
Very common in
Yeah.
our setting, which of course you have now a lot of eggs trying to come out, but they don't ovulate. So if you don't ovulate, then you have no period. So you find people with polycystic ovarian syndrome having a long period of no menstruation, and then when it comes, because the uterus is just waiting, you have heavy menses.
Yeah.
Or sometimes it can come as droplets. So it's a very uncomfortable syndrome. So that's one of the things that can cause an ovulation. Stress can cause
Stress.
yes.
Able talk about that. What do you mean?
When your body is under stress, there's
Yeah.
some systems that just will prioritize other things other than what they do when the body does not feel is a priority. Like if you're under stress, like you're probably doing exams, or you've changed environment. Most people who go to high school also and change the diet and all that, that kind of stress can prevent ovulation.
Yeah.
So you don't have a period for a long period of time, and you'll be explained where you will hear it's explainable, where you move to a new place,
Yes.
you don't get your period. You're having exercise, too much exercise, putting a lot of stress on your body. You can actually,
Really?
yes.
What should we do? Because exercises, you're told, is important.
Average. You
Lose
know, there's
weight.
ones who just overdo it.
Okay.
Yeah, you know, there's that, there's a certain, you can't do 3-4 hours of gym, you know, and not expect some of the things in your body to change. So high levels of stress, if you're thinking maybe there are economic problems or your workplace has issues, you might not necessarily ovulate as expected.
Okay.
Yeah, so those ovulatory problems are, it's from external things, from intrinsic things that you can have an issue with ovulation. Yeah, and then of course there are those people who have who are on medication, like the people on who have fibroids. Sometimes they can be injected this thing called GnRH, which can prevent ovulation, and therefore they will not have their period. And during this time, it can work as a contraceptive if you plan to do that, or it can prevent you from ovulating when you probably want to conceive.
So this injection is supposed to
Stop
fibroid?
ovulation. It's supposed to, yeah, it's supposed, you know, it's ovulation involves estrogen.
Yes.
And estrogen is the one that make the fibroids feed on estrogen.
Yeah.
So if you can stop these hormones, and especially estrogen, from going up by preventing ovulation, then you might be able to shrink the fibroids just a little. You're probably postponing surgery, but it helps to just stop the periods, and especially for those ones who have very heavy periods, they cannot go for surgery for one reason or another, then we give them this injection to stop their period. There's a side effect to it though, that's important. It puts you in a level of menopause. Yeah,
okay.
but you're not menopausal, but it puts you like as if you're menopause. So you have those symptoms of hot flashes and all that. Yeah, so there are people who also get premature ovarian failure for one reason or another, maybe because they smoke. Cigarette smoking is one of the reasons why some people will not ovulate. There are people who are on chemotherapy. Maybe they had a cancer when they were younger, or they were exposed to other chemicals and toxins that can cause this ovary. You know, those eggs that you had when you're a child, if affected, they will get over before the time you're supposed to at least expect it by the time you're 40 or 45 and above, you know. So if you have primary ovarian failure, then you get ovulatory problem. So that's ovulation only. An issue, the most common cause of infertility, what we call infertility in women, is anovulation, like not ovulating for one reason or another. Then the other one, and the most common these days that I see, is bilateral tubal blockage. Now the tubes, the fallopian tubes, the ones that carry the egg, for them to meet in the fallopian tube with the sperm, it's blocked, and usually blocked by infections. If you had surgery, you can also get, you know, what is called adhesions that can close, you know. So you have, the movement is not there.
Yeah.
So they will not meet. So you can't conceive when both tubes are blocked.
No.
If one tube is blocked, as I said, 1 month, the other ovary works. The second month, the other ovary works. So these people with one tube that's working can still conceive. So that's the good news. Yeah, so that's one of the most common. And the most common organisms that cause this is chlamydia, gonorrhea, most common, but there are others that can cause this blockage. That's why we keep saying, before you get into a relationship, get to know the partner, get to do STI screenings, because some of these things can really affect you later on in life. And you might not know because they have no symptoms until they block your tubes. Yes. Another common issue for infertility is fibroids. We've mentioned it.
Yes.
But fibroids are very notorious in our setup, very common in black race. So it's a combination of things: our diet, genetics, and of course, in this literature, they say being black and being woman in Africa, and in being black, you're more likely to develop fibroids as compared to other different races. So it's a very common problem. We get people with fibroids, and the problem with fibroids is that the fact that they take up the space which the egg, and when it makes a baby, it's supposed to go and attach.
Yes.
But now it goes and finds no space to attach because this fibroid has taken up that space. It works like a foreign object inside the uterus. And the other thing is that it just doesn't cause fertility problems, it causes subfertility. So you can, if it attaches somewhere and we're competing here with the fibroid, then you get pregnant, it grows, then the baby comes out. So you keep getting pregnant, you lose the baby. Get pregnant, you lose the baby. That's the most common problem with fibroids. And another one is if you've had surgery.
Yes.
Because if we are removing the fibroids, you can get now the adhesions that, it's scarring that can happen inside the uterus or even outside where the tubes are, because it's trying to heal, but it doesn't heal the right way, and then it blocks even the tubes. So fibroids is also a very big problem in our setup, very big problem. In fact, if you even test any reproductive age woman, you'll find at least one fibroid or two. But those small ones, it's not a big deal, but the big ones might actually affect your fertility. Okay. The other thing is we have, just before I even go into further, apart from unexplained infertility, some people don't understand the process of actually conceiving. It's good to not assume. And it's important because it's true. When I first see a couple, I want to understand, are you doing it okay? Are you okay? Are you consistently doing it? Because most of the time, the husband might have traveled. Maybe he's a truck driver. These guys are on the road throughout. So there's a problem. When you're not conceiving because he's been at home only once a month, only one day a month, how are we going to
long distance relationship?
Long distance relationship. So it's good to note that as much as we think of the big, deeper things, there are smaller things that we really don't talk about, but it's important for us to note. So it's important to have that discussion with your partner. Are we doing the right thing? Sometimes you might need some help, because, different reasons, for different reasons. The other thing, and very common these days, is endometriosis. Endometriosis has been a big issue. We also have now groups that, we have fibroid support group, we have endometriosis support group. Endometriosis now is the inner lining of the uterus is called the endometrium. When you find these parts of the endometrium in other places, like on top of the ovary, on top of the gut, on top of something, that tissue can go to different places. It's not a cancer, but it is it's just a tissue that goes to that grows in other places. So this now becomes a problem when you want to conceive, because what happens, whenever you have a period, because it's supposed to respond to the hormones that you're producing in your ovary, they also have a period. And you have
like double period.
No, you have period inside your uterus, but at the same time you're having period wherever that tissue is. So if it is on the umbilicus, because most people will present as an you have it's called a umbilical. You have the endometrioma at the umbilicus. That's in a belly button. Kitovu. There you'll have that thing. Whenever you're having a period, you're bleeding at that point. So it's very painful because this is a place where it's not supposed to be bleeding. It's very tender, and most people will have a lot of pain. So if you find the same tissue on the ovary, it kind of pours, the blood on the ovary, and this becomes toxic environment for the eggs. The only eggs you have in that ovary. So and then if we do surgery, we try and remove that part of the ovary with that tissue. We've removed parts of with eggs, so it becomes a problem. Endometriosis it can be widespread, It can even affect the gut, affect, you know, where it's bleeding also can cause adhesions when it's healing, and
Yes.
and cause blockage of tubes as well. So it has very many different ways that it causes, and even having intercourse is very painful when you have endometriosis. So women with endometriosis might find it hard to engage with their husbands, and that can also prevent, you know, now the normal process of conceiving, then you don't conceive.
Okay.
Yeah.
Yeah. Are all this, before I get to diagnosis, I want to imagine, you know, as a couple walk to Dr. Karen's office to find out if they are okay to conceive, which is one thing you push for. For men, you know, all these you've mentioned are ladies best.
Yes.
Are there also things that can cause infertility in men? Because making babies is a
Two-person
person's
thing.
affair. Yeah.
It is. For men now, there are several reasons they can have infertility. First of all, the act itself. If you have any issue, psychological issue, the stress, you're smoking, you're taking alcohol, the want is there, but you don't perform because you know, it starts from the arousal starts from the brain. It just starts. First you see, then you want to do it. But if you can't get that because there's a lot of distraction, disease, maybe you have diabetes, hypertension, you have family issues, money issues, all that, when it is in the brain, then it becomes difficult for them to perform. So you have people who have premature ejaculation, or they just are not able to remain firm to continue and have intercourse. So that is one of the reasons why we ask, are you really doing it the right way? So that is one of them. For men now, we have issues either with the testicle, before the testicle, or after the testicle, yeah? So before the testicle, we're talking about the brain. The brain, is there any issue that prevents you from having excitement, the stress, you're not eating well, you have disease, or you have a tumor that is preventing you from having your nerves probably working the right way, and then therefore you'll not be able to perform. And those things are usually affected by drugs and toxins. You're exposed to many things. If it's in the testicles, probably when they were younger, they had the testicles inside and descended testicles. And the thing is with this, it's important to note, even for those people who ride borders and what, testicles don't want heat.
Oh, Nduthi guys.
They are. The heat is, that's why they're located outside. Ours are located inside. But for men, they're located outside. So because of the temperature, they need to be cooler. So if the testicles were up when they were small babies and they were not descended, they were not removed from up in the abdomen, then for a long time, then they might develop issues with formation of we call them spermatozoa.
Okay.
Yes. Other issues, as I said, alcohol smoking mirror is one of those things that have shown that if you expose your testicles to heat, like when you're on Nduthi the whole time, people track drivers as well, because we see a lot of that because, first of all, they're away from their homes, and then they're always seated on a warm chair for a long time. That can also affect them. If you have mumps, mumps, they can cause a lot of infection in the testes. That can cause that. If you had something called varicocele, that is when your blood vessels around the testicles become bigger, that warms up the testicles. Then again, we have a problem. But after the testicles, so I'm just giving in general, because there are many other issues, but in general, if you also had issues with, maybe you had that, you went and did vasectomy. Of course, you will not produce sperm, but you'll produce semen. So that can be one of the reasons why you're not conceiving. Or if there's someone who had infection like chlamydia and gonorrhea, again, they block your tubes as a man. So they don't send the sperm to the right place. So there's so many other causes that are, very detailed. And I'm sure maybe most patients, the ones I've mentioned, most people will probably present with that. But for men, most of the time, it's usually dysfunction.
Okay.
Yeah.
Wow. That's a good point to pause. And,
Yes.
for married couples, Google, hope you're fine. But please send in your questions, 22232, 0708 222 323, at Hope TV Kenya on Facebook and YouTube. We are live. And of course, when we come back after the break, we'll be sampling your questions and comments. And of course, we'll want to ask Dr. Karen, So as a couple come to your office, what's the process of, diagnosing that will lead to saying, yes, you have fertility issues, and what's the interventions? Keep it right here at Hope TV, Look and Live. Let's have a quick break. We'll be right back.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of